Good evening, everyone. I'm Wayne Giles, Dean of the UIC School of Public Health, and I'm excited to have so many alumni, donors, faculty, staff, and friends joining us for this virtual celebration. We have two former deans joining us this evening, Susan Scrimshaw and Dean Paul Brant-Rolfe. And Dean Scrimshaw, it was great to see you a couple of weeks ago at the ASPPH, or Associations of Schools and Programs of Public Health annual meeting a few weeks ago. You did an amazing job in the plenary session. And thank you again so much for your leadership, both at UIC and beyond. I see we have a number of individuals who are joining us and entering information into the chat box. Please feel free to enter your information and enter information about what class you're from and what year you graduated as well. We have a fun hour-long celebration planned for you, and we're so glad you are here with us this evening. As many of you know, 2020 was the year the school celebrated its 50th anniversary. For those of you who logged on a little bit early, I hope you enjoyed our slideshow that included photos of our history over the past 50 years. Little did we know when we planned the 50th anniversary celebration last year that we'd be in the midst of a global pandemic. While it was very disappointing for us to have to cancel last year's celebration, as public health leaders, we were quick to pivot our attention to addressing the largest public health crisis any of us have ever faced. Many thanks to our awardees who have been patient with us as we rescheduled this event. We're so glad to be able to honor you virtually this evening, and you're in for a real treat this evening. Now, as vaccines are being rolled out, many of us are seeing a light at the end of the tunnel. And so tonight, we pause and celebrate the accomplishments of the UIC School of Public Health over the last 50 years. Please join me in watching a short video.
So the school started back in 1970. And if you think about what was happening both in the nation and then also here in Chicago, there were a group of faculty and members of the Illinois legislature who were particularly interested in sort of moving Chicago, the state, and the nation forward in terms of public health issues and activism. And that really was a lot of the start of the School of Public Health.
So I envision the school's legacy going forward are going to be its contributions to improving public health through our research and our advocacy and contribution to policy and implementation, and through our training of our students so that they are aware of public health and the issues that are facing the public today and how to best tackle those in an effective way.
I've been here for 33 of those 50 years. And to me, after all these years, we now have established ourselves. We have a strong alumni base. And what are our alums doing? They're the leaders in the community.
The greatest legacy are the students. We have 5,000 alums now. So there's a tremendous legacy and people working in Illinois and the Midwest, but throughout the world.
I think there are several things that we want to think about as we move the school for the next 50 years and beyond. We need to be thinking about and focused on making sure our students are well equipped to meet the challenges both of today and of the future. Number two, making sure our research is cutting edge. And we need to be nimble. And I think if we're able to do that effectively, we will continue to be one of the top schools of public health in the nation.
I'd like to think that we're a school that really makes a difference in the communities that we serve. And once again, that extends from local to global. That special sense of mission, that special sense of a public institution having a responsibility, a mandate to take what it's doing as an academic institution and change it into real-world change or impact is what is important about this school.
I think what's kept me here for 33 years is the fact that I really respect my colleagues. I think that leads to a very rich learning community here.
I really think that the unique niche
that the University of Illinois Chicago School of Public Health can fill is one of really training high-quality public health practitioners who can really make a difference in the field.
When I think about a moral imperative for this work, I think about what needs to be done to ensure that every young child and young person growing up here on the near west side of Chicago has just as much opportunity for their lives and their careers as a young child living anywhere else in our city.
There's not a better group of future public health leaders that we have that are going to be able to challenge and overcome many of those challenges that public health will face.
What a great video. I'm always inspired when I see it, and I hope you are as well. This past year has been challenging for everyone, and the video, filmed before the pandemic, doesn't begin to touch on the amazing work we've done over the past 12 months. As the COVID-19 pandemic continues to evolve, our commitment to communities across the state and around the globe has not wavered. We saw the need to create an incident command structure within the School of Public Health. We created a website and an email address that allowed us to respond to requests from local health departments and the public. But it also created an important venue for our alumni and students to volunteer, and many of you did. The School of Public Health continues to serve a leadership role with the City of Chicago's COVID-19 Contact Tracing Corps. We are also testing water samples across the city, most notably at the Cook County Jail, to rapidly pinpoint outbreaks. Our Collaboratory for Health Justice is engaging with community partners to address hesitancy towards vaccines in our community. And our work to strengthen communities extends beyond the pandemic. The Collaboratory is the co-author of a new report on the redevelopment of the Calumet River area in the southeast side of the city. It's reporting on residents' experiences with and solutions for environmental hazards. Unfortunately, one of the hidden impacts of the pandemic is the increase in opioid overdoses across the city. As a new study from the School of Public Health breaks down key drivers of opioid overdose deaths in Cook County and compares them with national data. Our Global Health Program recently hosted an international conference on frugal innovations in global healthcare. It highlighted cost-effective strategies that can transform health access for many people. I could go on and on and on about the incredible work being done by our students, faculty, and staff, but we've got a lot to cover this evening. Before we begin with the awards presentation, I do want to thank this evening's sponsors. We appreciate the generous support of our sponsors, including our platinum sponsor, Blue Cross and Blue Shield of Illinois. All of this evening's sponsors are listed on the screen. I'd also like to take a moment to thank all of the members of our Founders Circle and Legacy Society who are joining us this evening. The UIC School of Public Health has been supported throughout the years by the generous gifts of many loyal friends. These two giving societies honor a distinguished group of leadership donors who help us prepare our students for success by making annual gifts to the school and also through their estate plans. Without further ado, I'd like to move our program forward to the award presentations. And again, here you are in for a real treat. We will honor 6 truly incredible alumni who have made significant contributions to public health and are leaders in public health. Please check out the chat box for a link on our website to view the full bios of the award recipients. I'm truly proud to call these amazing individuals alumni of the School of Public Health. To present the first set of awards, I'd like to introduce to you all Ms. Clarita Santos, a School of Public Health alumna who is a member of the school's Executive Advisory Board and Executive Director of Corporate and Civic Partnerships for Healthcare Service Corporation. Clarita.
Thank you, Dean Giles. It is an honor to be here this evening and to highlight the first 3 awardees. Each of these awards are divisional awards presented to alumni who have achieved national, regional, or statewide prominence either in their professional fields or through their involvement in civic, cultural, or charitable activities. The first award is a Dr. Jacob Brody Epidemiology and Biostatistics Alumni Achievement Award, nominated by Dr. Larry Owlett, Research Professor Emeritus and Associate Director of the Community Outreach Intervention Project. This year's recipient is Dr. Dina Brose. Dr. Brose, who earned both her MPH and PhD from the School of Public Health, was immediately hired by the CDC after graduation as part of the Epidemic Intelligence Service in the Division of Global HIV/AIDS, where she has provided technical guidance for national HIV surveillance systems in Kenya, Tanzania, and Ethiopia. She quickly made a name for herself as an expert in all things related to injection drug use and harm reduction. She began authoring publications and being invited to speak all around the world. She currently serves as an epidemiologist in the Division of HIV/AIDS Prevention, where her work focuses on developing and implementing biobehavioral surveys in key populations at increased risk for HIV, including people who inject drugs, men who have sex with men, and women who exchange sex. She is now the official subject matter expert for the CDC's Division of HIV/AIDS Prevention, which means all materials and inquiries related to this topic go straight to her. Now that's impressive. Congratulations, Dr. Brose, on this much-deserved award.
Thank you to the award committee for selecting me for this great honor. I am truly humbled to receive this high recognition in Dr. Brody's name. Dr. Brody was my advisor in epidemiology when I first began my studies at the School of Public Health nearly 20 years ago. Dr. Brody was a mentor who always prioritized his students and ensured that we were on a path to success. I remember him to be humble and rarely speaking of his many accomplishments. He was much more interested in us and our futures in public health. I count myself among those fortunate to have known Dr. Brody and who have benefited from his infectious passion for disease prevention and genuine determination to improve the world. I would like to especially thank Dr. Larry Willett for nominating me for this award. Dr. Willett became my research mentor and then supported me throughout my PhD studies. I consider him my mentor to this day. I will be forever grateful to Dr. Willett for giving me a chance so many years ago and letting me work on the Community Outreach Intervention Project's Outreach Van, which delivered HIV prevention and harm reduction services to people who use drugs. This is where I found my home and purpose in public health and what has influenced my career in epidemiology to this day. I learned firsthand the importance of combining high-integrity research with strong, immediate benefit and service to the community. I learned from the many COIP staff who shared their stories with me that public health cannot exist separately from human rights and social justice. I am thankful for their trust in me. Over the past year, when the COVID-19 pandemic has made everything difficult and much more urgent, learning about COIP's efforts to reach out to those who need them despite the enormous challenges was true inspiration for me to continue to work even harder and to serve. This award represents so much to me, and I am inspired by it to do more. Thank you again for this great honor.
Our next award is the Dr. Naomi Morris Alumni Achievement Award for Community Health Sciences, and this year's recipient is Dr. Franklin Cozy-Gay, who was nominated by Dr. Nadine Peacock, Associate Dean of Diversity and Inclusion and Associate Professor of Community Health Sciences. Similar to the last awardee, Dr. Cozy-Gay is a Dunn alumnus from the School of Public Health. I guess sometimes it's not enough to get a master's degree, and that when you feel called to continue to learn about your specific area of public health, you must continue and go on to get a doctorate. Dr. Cozy Gay currently serves as the Executive Director of the Chicago Center for Youth Violence Prevention, which is housed at the University of Chicago School of Social Service Administration. With over 20 years of experience identifying the nature and causes of violence, he has partnered with community stakeholders to support a comprehensive and coordinated response to the root causes of violence. His long and robust record of leadership in research, program design, and implementation, and civic engagement is truly inspiring. We are honored to call Dr. Cozy Gay an alumnus and congratulate him on this award.
Thank you, Clarita. It's so great to be introduced by you. Seeing you brings great memories. I'm Franklin Cozy Gay, proud UIC alum, 2019 PhD, 1998 Master of Public Health in Community Health Sciences. I am honored and filled with pride to accept the Dr. Naomi Morris Alumni Achievement Award for Community Health Sciences. Dr. Morris made outstanding contributions to maternal and child health. I am humbled to receive an award in her name. I want to thank Dr. Shafdeen Amuo for motivating me to pursue a career in public health when he presented at an event I helped organize for minority pre-health students on UIC's East Campus. I was inspired that the goal of public health is neither to determine fault nor place blame on individuals, families, peer relationships, or communities, but to focus on prevention. My leadership as the Executive Director of the Chicago Center for Youth Violence Prevention and as the co-director of the 1919 Chicago Race Riots Commemoration Project emphasizes emerging public health practice that goes beyond looking at risky behaviors and instead focuses on examining root causes of violence, such as the social, economic, and political inequities tied to class and race. I offer gratitude to Dr. Susan Scrimshaw and Dr. Nadine Peacock, who taught me how to get proximate to my phenomenon of interest. Special shout out to Dr. Peacock for helping me through difficult times. I want to thank Dr. Fred Kaviz for helping me understand the best methods to access my sample, as well as sharing a strong love for the Chicago Bulls. And Dr. Arden Handler for challenging me to consider the best approaches to have policy level impact. In the legacy of Dr. Naomi Morris, I aspire to not only contribute to research, but also through diverse service, elected and volunteer, at the community, city, state, and national levels. Finally, I want to thank the past and current School of Public Health staff, including Renita Moore, Madge Swine, Joan Chow, John Slavic, and Emily Pasteris for keeping me in line, and most importantly, keeping me connected. UIC School of Public Health is a special community to me. Thank you again for this honor.
Our next division award, and the last I will introduce, is the Health Policy and Administration Alumni Achievement Award, which is being presented to Ms. Sherry Cohen. Ms. Cohen served as a member of the school's Alumni Council for many years and was nominated for this award by Dr. Jenny Hebert Byrne, who is also an alumni of SPH and serves as the Interim Associate Dean for Community Engagement and Associate Professor for Community Health Sciences. In her role as the Senior Health Planning Analyst at the Chicago Department of Public Health, Ms. Cohen directs the Partnership for Healthy Chicago, a coalition bringing together diverse sectors of the public health system. Under her direction, the Partnership for Healthy Chicago has developed and implemented over 5 community health assessments and plans. The main goal of her work is to achieve health equity by addressing fundamental systems level issues through community engagement, stakeholder alignment, institutional coordination, and policy development. It is an honor to present Ms. Cohen with this much deserved recognition.
Thank you, Clarita. And thank you to the Alumni Council of the School of Public Health for this recognition. And as always, thank you to my friend and colleague, Jenny Hebert-Byrne. I am so honored to be acknowledged by my peers. This is a time for me to look back through the many years since I was a student at UIC in the old building on Taylor and reflect on the opportunities that I have had since that time. Some of my best experience focuses on building and sustaining partnership. Through the partnership realm, I brought many diverse sectors together and let them know that they are part and integral to the essential work of public health. That hadn't been so easy several years ago. It took some convincing, securing data for them, and baking snacks for the meeting to keep these organizations at the table. But as public health moves its work on anti-racism, social justice, and equity to the forefront, organizations are now pursuing us. I've learned so much from these partners and colleagues, many of whom I've met through UIC. I have learned the power of community, strength-based approaches, honoring and respecting others, and the importance of perseverance. And it looks like my perseverance may have paid off, as a few of my long-term initiatives are finally coming to fruition. I feel so lucky to be part of this profession and connected to UIC. When I come into classes to lecture, I am very impressed to be able to have such thought-provoking discussions with the students. And I'm also impressed by all the opportunity the school provides them to experience that all that public health has to offer. Thank you again for this recognition and for encouraging the great work of the public health community.
Thank you, Clarita, for introducing those truly incredible alumni. Let's go ahead and congratulate them all one more time for their outstanding achievements in public health. Please feel free to enter your congratulations into the chat, or one of my favorites, use jazz hands to give them thanks. We're going to take a brief pause now from honoring our alumni to have a little bit of interaction and a lot of fun. The School of Public Health is going to be hosting a trivia competition. And to lead this activity, we have Ms. Kara Beskin. She is co-chair of the Alumni Council. Please welcome Ms. Beskin.
Thank you, Dean Giles. Let's play some trivia! Okay, before we get started, I want to walk everyone through how to play. You should see a QR code directly below me. If you have your phone handy, you can scan the code with your camera and the link for the game should pop up. If you don't have your phone, you can play on your computer too. Just type in crowd.live/UIC-SPH to join. You can also find the link in the chat. Once you're in the game, you should be able to see a space for your first name and last name and email. You'll want to use your real name and email because there are real prizes associated with the high scores. I'll give everyone a few seconds to pull up the game now. We'll get started in a moment with a test question. Once I read a question, you'll have 20 seconds to answer. The scores are calculated based on how quickly you respond. So time is of the essence. There are only 9 questions, so please join me in playing. You'll have some fun and you might learn something too. So our first test question, there's no right or wrong answers here. No points will be awarded for this question. We just want to give everyone a chance to try this platform out. This year is certainly different, hosting this event virtually. And our alumni celebration has been at some very fun venues in the past, including Willis Tower and the Field Museum. And we hope to be back in person next year. Fingers crossed we'll be able to do so. So tell us, have you attended a SPH alumni celebration in the past? Should see the options on your phone or computer. A, yes. B, no. Five seconds remaining. Get those answers in. All right, let's see the distribution. Fantastic, look at that. 83% of those in the audience have attended an alumni celebration before. Thank you all for your continued support. And for those of you who are turning in for the first time, 18% of you, welcome. We're happy you're here. After each question, we'll show a leaderboard. But since this is the first one and it's unscored, we'll move on to the second question. As you all know, the school celebrated its 50th anniversary in 2020, and tonight's event is the final event to celebrate this milestone. How many students graduated in the first class of 1973? You'll see the options on your phone or computer. Time is of the essence, so get those answers in. Is it A, 11, B, 38, C, 57, D, 200? 3 seconds remaining, 2, 1, time's up. Let's see the distribution. How did the audience answer? Ooh, it's pretty split between A and B, and the correct answer is B. 46% of you guessed right. Congrats. Let's see that leaderboard. All right, Diane, 100 points. Congrats. Followed by Lorraine. Excellent work, everyone. You should be able to see your name and see how you're doing. And remember, there are 9 questions, so if you're not on there yet, you still have time to catch up. Let's move on to question 3. Each dean of the school leaves their mark on the school public health. One of our deans felt strongly about beautifying the building with art. Here's a photo of some recent students standing in front of the art that greets visitors as soon as you walk in the building. Which dean inspired us to put artwork around the building? Was it A, Susan Scrimshaw, B, Dr. Paul Brant-Ruff, C, Dr. Jacob Brody, D, Dr. Paul Q. Peterson? The faster you answer, the more points you get. 5 seconds remaining. And that's it. Let's see the distribution. Excellent. 54%, the majority of people guessed right. It is Dr. Scrimshaw. She certainly left her mark on the school by making it a more beautiful place to study every day. Let's see the scoreboard. All right, Lorraine Conroy moving into the lead, followed closely by Nadine Peacock. This is a close one, only 10 points differentiates between them. This is going to be a fight to the end. I can't wait to see who wins. Let's move on to question number 4. Several years ago, the school decided to launch an undergraduate program in order to reach a larger audience of students interested in the degree of public health. Which year was the undergraduate program started? Was it A, 2017, B, 2010, C, 2012, D, 2015? Get those responses in. The sooner you respond, the more points you get. It's 5 seconds remaining. And let's see the distribution. How did the audience respond? Looks like the majority of people guessed 2015. The correct answer is actually C. So 30% of you nearly, congratulations. Let's take a look at the scoreboard. Lorraine still in the lead with 278 points. Joy Getzenberg, love to see it. She jumped up there with 246 points. Excellent work. Let's move on to question 5. Our global health program is one of the largest programs in the country. Many of our students receive scholarships in order to support their travel abroad to conduct their practicum. How many countries have UIC students studied through in the global health program? Is it A, 43 countries, B, 19 countries, C, 22 countries, D, 26 countries? What do you think? 5 seconds remaining. Get those answers in. All right, let's see the distribution. How did we do? All right, 27%. Oh, excuse me, I didn't see the blue. 42% answered A. Actually, the answer is C, 22. That's quite a lot of countries, but not as high as 40s. Let's move on to the leaderboard. Who is in the lead now? Ooh, Bob Brewer took over the leaderboard at 310 points, but Lorraine and Joy are still giving as many points as they can. I love to see all these names everyone's playing. Thank you so much for playing along. Let's move to question 6. The next few questions are about the building where SPH is housed. In-person students spend countless hours in the building, and I can attest it begins to feel like a second home. SPH is undergoing some major renovations to update its space at 1603 West Taylor. Take a look at this photo and let us know, what room do you think it is? Is it A, the auditorium, B, the gym, C, the student lounge, or D, room 920? 10 seconds remaining. Get those answers in. 5 seconds remaining. Let's see how you answered. All right, congratulations. 50% of you guessed right. It is indeed the gym. The student lounge has been renovated recently as well, though. The basketball hoops are gone, and now it is a high-tech learning classroom. Let's see the scoreboard. Lorraine Conroy back in the lead. Ooh, we have Michelle Taylor who jumped up to number 3. Excellent work, everyone. We're almost hitting the 400 points mark. You can see, if you're playing, your name will scroll across the bottom. Let's move on to question 7. Prior to being housed in the building where the school currently resides, SPH was housed in a former convent. Which year did the school move from a convent to this former psychiatric hospital? Was it A, 2007, B, 2001, C, 1984, D, 1997? 10 seconds remaining. Get those answers in. 3, 2, 1. Let's see the distribution. How did the audience respond? Ooh, it's pretty tied. 34% guessed B and 34% guessed D. And the correct answer is B. It was 2001. Let's see the scoreboard. Lorraine Conroy back in the lead. We have some new names up there. Congratulations, great work. Let's move on to question 8. Did you know there's a series of underground tunnels near the School of Public Health building? How many different buildings can you get to via these underground tunnels from UIC School of Public Health? Is it A, 2, B, 6, C, 3, or D, 5? 10 seconds remaining. Get those responses in. All right, let's see the distribution. How did you respond? Okay, 34% guessed C for 3, and 30%, follow closely, guessed B, 6. It's actually D, it's 5. Congratulations to the 17% who got that one right. Let's see the scoreboard. Has there been an upset? Nope. Lorraine Conroy is still in the lead, but Brandon Seeloff, great, is up at 2. Michelle Taylor, still at number 3. Great work, everyone. Love to see it. Thanks for playing along. This has been so much fun. Unfortunately, we only have one question remaining. As the dean mentioned, I volunteer on the school's Alumni Council. We are a group of dedicated individuals who do event planning and fundraising to ensure that public health education is attainable for everyone. I love meeting fellow alumni through my work and volunteer activities, and every time I meet a fellow alumni, we share an automatic bond as a fellow flame. Our last question is, around how many alumni does the UIC School of Public Health have? Is it A, 12,000, B, 7,000, C, 5,000, D, 3,000? Five seconds remaining. All right, this is the final. Oh, first of all, let's see the distribution. What did everyone guess? All right, 43% guessed C at 5,000, followed closely by 30% at 7,000. The correct answer is C, indeed. It is 5,000. All right, let's see the final leaderboard. And the winner is Brandon Seeloff, taking it at the end, right from Lorraine Conroy. Oh, she was in the lead for so long. That was so fun. Thank you for joining. I know I learned a lot about my alma mater from this experience. The top winners of tonight's trivia game will be contacted by the UIC Office of Advancement to claim their UIC swag winnings. Now I have the pleasure of introducing our next speaker, who is presenting the 3 final alumni awards this evening. Dr. Suzette McKinney is an alumna of our DRPH program and currently serves as the chair of the UIC SPH Executive Advisory Board. She served as the CEO of the Illinois Medical District and most recently joined as principal and director for Sterling Bay's Life Sciences Division. In 2016, Dr. McKinney was honored by the School of Public Health as the recipient of the Distinguished Alumni Achievement Award. Welcome, Dr. McKinney.
Thank you, Ms. Beskin. It truly is an honor to be with all of you this evening. Our last divisional award of the program is the Environmental and Occupational Health Sciences Alumni Achievement Award, which is being presented to Captain Michelle College. She was nominated by Dr. Mark Johnson, an alumnus of our EOHS division, who is the Regional Director and Senior Environmental Health Sciences for the Agency for Toxic Substances and Disease Registry. Captain College has served in a leadership role for many high-profile and impactful environmental health projects over the course of her career. She is a captain in the U.S. Public Health Service Commission Corps, one of the 8 uniformed services of the United States, overseen by the Surgeon General. In this special role, Captain College is called upon to protect, promote, and advance the health and safety of the nation, and we are forever grateful for her service. Captain College also serves as an expert research officer in the Chicago field office of the Agency for Toxic Substances and Disease Registry in the Centers for Disease Control and Prevention. And she has been with the CDC for over 20 years. In this role, she works with citizens, enforcement agencies, and state and local health partners to characterize and mitigate residential exposures to toxic substances. Many congratulations to Captain College for being named the 2021 Environmental and Occupational Health Sciences Alumni Achievement Awardee.
Thank you, Dr. McKinney. Hello, and thank you for this wonderful honor. I started an MPH in epidemiology 24 years ago at Florida A&M University in Tallahassee after losing my mother to ovarian cancer a few years before. I learned in an undergraduate biological anthropology course that human evolution and genetics, as well as environment, can cause the development of chronic conditions like cancer. It seemed to make sense to move on to epidemiology from an undergraduate degree in biological anthropology. At Florida A&M and as a student intern, I rotated through the Agency for Toxic Substances and Disease Registry at the Centers for Disease Control in Atlanta, Georgia, in environmental health. I loved it. I decided that was my calling, and I was hired there in 1999. We moved to Chicago in 2001 so that my husband could study instrument making, and I transferred to ATSDR's regional office here in Chicago in Region 5. I began my prereqs for the School of Public Health in 2002 and started my degree program in the fall of 2002. I worked full-time and went to school part-time with support from my agency and graduated in 2008. I wanted to thank all the people who helped me get here, especially Dr. Lorena Madrigal, who lit my curiosity in disease and populations way back in the 90s at the University of South Florida, where I studied human evolution with her as my advisor. I got to CDC with the help of Dr. Cynthia Harris at Florida A&M University, and of course, I have to thank Dr. Peter Steff and Dr. Lorraine Conroy here at UIC, who gave me the benefit of the doubt about completing a PhD as a working part-time student. Peter's brilliance, support, and guidance as my advisor cultivated an understanding of air quality that I apply to my work every day. On top of that, he's just an excellent human being. I've had the great fortune of working for another brilliant scientist and UIC School of Public Health alumni and faculty member for the last 20 years, Dr. Mark Johnson. Mark cares deeply about public health and about advocating for what is right and just, and has been a great example of what a public servant should strive to be. He's another excellent human being. In short, I was privileged enough to be supported and encouraged by these wonderful people to think outside the box and to fearlessly and tirelessly work to improve the quality of life for the communities I work with. It's an important calling to serve others for the basic right to live in a safe environment, and I get to do it every day. Thank you, everyone, and I'm humbled to be in your esteemed company.
Our next award is the Distinguished Alumni Achievement Award, which is being given to Dr. Jay Bott. Dr. Bott was nominated separately for this award by myself, as well as Dr. Lee Francis, an alumnus of the School of Public Health, who also serves on our Executive Advisory Board and is CEO of Erie Family Health Centers. Dr. Bott is a born leader and innovator who has dedicated his career to leveraging his analytical and clinical skills to improving health here in Chicago, statewide, and across the country. He is the founder and principal of JDB Strategies, a health equity and innovation consulting firm, an ABC News medical contributor, a physician executive, internist, geriatrician, and widely quoted expert on the most pressing challenges and exciting opportunities in healthcare. Prior to launching his own consulting practice, he served as Senior Vice President and Chief Medical Officer of the American Hospital Association. In this leadership role, he was responsible for nearly 5,000 hospitals, healthcare systems, networks, and other providers. As a presidential leadership scholar, he shared the stage with Presidents Bill Clinton and George W. Bush for a discussion on the challenges in veterans' healthcare. And I could go on and on. Please join me in congratulating my friend, Dr. Jay Bott, on being named the 2021 Distinguished Alumni Achievement Awardee.
Thank you. I'm honored and humbled to be recognized with my fellow honorees who inspire me to be better. I deeply admire and respect them and their work. I want to thank the University of Illinois School of Public Health, Dean Giles, the alumni team, and the awards committee. I'd like to also express gratitude for my friends and colleagues, Dr. Suzette McKinney and Dr. Lee Francis, who nominated me. I've had the good fortune of working with both of them, and they are just dynamite. We are so lucky to have them as part of the School of Public Health family and here in Chicago, making health better. Dean Giles, Dr. McKinney, Dr. Francis, you lead by example and provide us with all an inspiring vision of a future for healthcare in which public health plays a larger and more prominent role in providing exceptional care to our communities with the talented workforce that reflects the diversity of our nation. If the COVID-19 pandemic has taught us anything, it's that the lack of public health infrastructure and health inequities are America's chronic condition. In Chicago, where we live, Black residents make up 30% of the city's population, but they account for 60% of the COVID-19 fatalities. These numbers should shock us, and more importantly, stir us to action. As public health physicians, we're just not trained to treat those in front of us, but look at the neighborhood as our patient. And so I say public health professionals across our state and nation should continue to show how important it is to not only address social needs, but social determinants and health inequities, systemic and structural as well. That means combating the systemic racism that keeps people of color poorer and sicker than their white counterparts. It means building state-of-the-art care, both in brick and mortar and virtually, not just in rich neighborhoods, but in neighborhoods where the sickest people live, providing equal access to care for all Americans, regardless of their skin color or their median income and their zip code. Last, it means committing ourselves to opening up professional opportunities to people of all backgrounds and guaranteeing that our public health and health systems mirror the diverse communities they aim to treat. Now, for me, an education at the University of Illinois Chicago School of Public Health was so critical because it allowed me to contribute in a meaningful way as a former public health official at the Chicago Department of Public Health, to see problems and issues through intersecting lenses so that we move towards health, which we know not only requires clinical care, but requires treating the neighborhood. Now, these are lofty goals, but I'm inspired by the actions of the people of the University of Illinois Chicago School of Public Health. And so, again, I thank you for this honor and salute you for your hard work. Thank you so much for this award, and I look forward to contributing with all of you to make public health the best it can be, not only in our city, not only in our state, but also in our nation. Thanks so much.
Since its founding in 1970, the UIC School of Public Health has consistently been supported by generous benefactors. This next award, named the Champion of Public Health Award, was established during the school's 40th anniversary and is presented to a donor of the UIC School of Public Health who, through direct financial support, has demonstrated outstanding charitable responsibility and whose generosity encourages others to participate in public health philanthropy. This year's recipient is Dr. Denise Oleski. Dr. Oleski has been a member of the School of Public Health community from the very beginning. She received her MPH in 1974 and PhD in 1983 from the Division of Epidemiology and Biostatistics. Currently, Dr. Oleski works as the Director of Epidemiology at AbbVie, but her career has spanned academia, research, and healthcare. As the immediate past chair of the Dean's Executive Advisory Board, she helped lead a vision grounded in a partnership between the academic voice of the school and the business community. In honor of the school's 50th anniversary, Dr. Oleski generously established a new scholarship called the 2020 Scholarship Fund. This scholarship is fully endowed and will support graduate students into perpetuity. The scholarship honors an important time in our history, with the hope that in 50 years, students will look back at this time and know that we were committed to their success. I am truly inspired by Dr. Oleski's commitment to the school. Please join me in honoring her as this year's Champion of Public Health.
Thank you, Dr. McKinney, for that thoughtful introduction. I'm both honored as well as humbled to accept the Champion of Public Health Award this year from the University of Illinois School of Public Health. But first, I wanted to thank Dr. Dean Giles, who continues to do an exceptional job leading the school and making an incredible impact on the future of public health, not only in the Chicago area, but nationally, as well as globally. I would also like to thank my colleagues, classmates, friends, and family who are at home, like me, watching in this interesting virtual time. When you receive an award like this, it really makes you reflect on your education and career. And my career as an epidemiologist. Who could think that back in the 70s and 80s, when I went to school, started at the University of Illinois School of Public Health, as an epidemiologist, that epidemiology and epidemiologist would be a household word, not only in the US, but globally. I started my career with exposure to a number of fantastic faculty, including Dr. Paul Levy, the statistics guru, with whom I've learned a lot. And as you know, statistics is a background for a lot of the public health initiatives. I also had the opportunity to have, as a faculty, Dr. Bill Henzo and also Dr. Bruce Douglas. Dr. Bruce Douglas gave me the exposure to public health practice because I had the privilege of working with him to develop some legislation in the state of Illinois aimed at reducing risk of exposure to lead poisoning in some of our most vulnerable communities. And when I think about my academic career, it actually began when I was admitted, believe it or not, to the University of Illinois PhD program in microbiology and immunology. But it was one afternoon that I was sitting in a cafeteria, happened to have a conversation with a physician from Egypt who was talking about this new school of public health. And how he described it to me, it was the application of science to promoting the health of populations. I was sold. And sure, soon enough, I enrolled in the University of Illinois School of Public Health to start my master's program. I've had the privilege also of working with a number of faculty outside my academic setting that includes Dr. Faye Davis and Dr. Dan Hororchik. And needless to say, even in this day, the importance of public health education cannot be overrated. I'm incredibly proud to be a part of the School of Public Health as an alumna, and my admiration and respect for the institution is what inspired me to start the 2020 Scholarship Fund, which supports scholarships for graduate students in public health. It is providing broad support not only for tuition, but also for the resources that are so necessary to support their education and eventual success in public health. This year has undoubtedly shown us that being trained in public health is more important now than it's ever been before. And it's up to us, not only up to us, but it's our obligation, the way I look at it, to educate the next generation of professionals who will be leaders and not only have the skill to develop the next vaccine, but will have the knowledge to design and implement an effective and ethical rollout of that vaccine so that our most vulnerable are taken care of. If you are able, and I hope that you are, that you'll consider also supporting the 2020 scholarship and invest in the future of our public health professionals. So in closing, I would like to say thank you to everyone around the world working tirelessly to keep us healthy and safe. Thank you to the faculty, staff, and students of the University of Illinois School of Public Health for dedication to public health practice and to research in our communities. I'm very proud to be an alumna of the School of Public Health of the University of Illinois, and I'm very deeply honored to receive this award. So thank you again for receiving this award.
What a wonderful group of public health professionals. And I hope you are inspired by hearing their stories as I was as well. Before we say goodbye, I want to welcome one final person to our celebration. We just heard from Dr. Oleski about the establishment of the 2020 Scholarship Fund. And there's no better way to demonstrate the impact that scholarship support has than to hear directly from a student who has benefited from such generosity. Here with us this evening is a current School of Public Health student, Hannah Bonecutter. She's an amazing individual, and she will be graduating with her Master's of Public Health degree next month. She's going to speak briefly about how generous financial support from alumni and friends of the school has helped her to achieve her dream of obtaining an advanced degree in public health. Hannah.
Thank you, Dean Giles. It is an honor to be with the SPH alumni and donor community tonight. I am truly inspired by the awardees this evening, and I look forward to the day soon when I can call myself an SPH alumna. Listening to Dr. Oleski earlier speak about why she established the 2020 Scholarship Fund, I couldn't help but feel so extremely grateful. As a scholarship recipient this year, it truly makes me appreciate the generosity and commitment that donors have by investing in those of us who are new to the field of public health. In all honesty, I am a person just trying to beat as many odds that I can, doing my best to overcome some of the adverse effects that certain social determinants of health have forced me to experience over my lifetime. Scholarship support has allowed me to not overcome some of these adverse effects, but thrive while doing so. Thanks to your generosity, I will realize my goal of graduating with my MPH while reflecting a strong record of achievements and success. Thank you. As I near graduation, I envision using my degree in public health to trailblaze a new industry. The purpose of this industry is to provide informative content to the mass public on important societal issues that they need to understand, but in a highly engaging, creative, and entertaining way that demands their attention. My goal is to utilize my knowledge, skills, and networks gained within and outside of my public health master's program to create and grow this industry. Right now, Due to the global health pandemic, the field of public health is in the spotlight. Now more than ever, we need dedicated professionals with the skill sets and knowledge to address the health and well-being of the public, especially those who are most vulnerable. The UIC School of Public Health is truly a leader in our nation's public health workforce, and they couldn't do it without the generous support of donors like you. Thank you for helping us make the world a better place for all.
Thank you, Hannah. And when I hear you speak, I am so inspired, and I am so inspired about the future of public health. If you are interested in supporting the 2020 Scholarship Fund, and I understand we already have 4 donors who have donated to the fund, but if you want to help students like Hannah achieve their dreams, scroll down to the bottom of the event landing page and click the Donate Now button. You can also visit publichealth.uic.edu and click the Make a Gift button at the top of the screen. Again, I want to thank everyone for joining us tonight for this celebration of the school's 50th anniversary and our incredible awardees who were just so inspirational. We always love to hear from our alumni and friends. Please check out the chat box for links to our Facebook page, to follow us on Twitter, or to join us on LinkedIn. We have many great virtual events planned for the coming years, and I'm hopeful we'll have some in-person events coming in the future as well. We hope to see you all very soon. Please have a great evening, and please stay safe. Thank you very much.